Hello, my name is Phil Kane and I've worked at the Walton Centre for 40 years this year. I've seen lots of changes and my experiences are vast over this period of time.
Paint a picture for us. What was it like when you started?
When I very first started, I started at the Children's Hospital in Myrtle Street, completely different to today. The wards were run by a ward sister who was very strict, who you never spoke to unless she actually spoke to you. She would look at you and eye you up and down and make sure that your uniform was crisp. At that time we used to wear striped dresses with the white starched apron, white hat and white starched collar as well. All the beds had to be aligned in the same direction with the wheels facing, pillows had to be away from the doors, and also the counterpanes had to have a stripe right down the middle of the bed. Everything was very, very strict in those days. You only spoke to the nurse that was 1 year ahead of you, and the staff nurses and the sisters you never spoke to at all.
And you didn't come to work, did you? You actually lived in. What was that like?
Oh, we lived in. You weren't allowed to live at home, so you had to live in the nurse's home. That was run by a home sister who almost became your surrogate mother, and we used to have to ask permission to go out of an evening, and we could have one late key a week, and that was till 10 o'clock at night, and they would be waiting at the door for you to make sure that you were in on time.
Did nurses get into trouble?
Yes, all the time, for sneaking in after hours and trying to avoid the home sister or the night sister that would be on duty in the hospital. We used to have to come in through the main hospital and go through into the cellar to get into the nurse's home. So we used to crawl underneath the office and hope that we were never seen, but invariably we were found out.
You say we, so you did that?
Oh yes, yeah. Oh, on a few occasions, yes, yes.
What was the atmosphere like then, and how is it different?
Very strict. You didn't speak to anybody. Nobody was spoken to by their first name. It was always nurse or staff nurse or sister. Very strict, but supportive network. Everyone was very keen to teach you the right things to do, and there was a lot of emphasis on teaching. And I suppose that's where you got your clinical experience, because we didn't have, you were employed by the hospital at that time, whereas nowadays people are employed by the universities and they're just seconded in for some clinical experience. But we were actually employed by the hospital, and we had clinical tutors, and we had time out each year during our training to get the theoretical experience. But most of our time for qualifying, up to qualifying, was ward-based, so we adapted an awful lot of clinical skills along the way, which we were taught by senior nurses. We used to eat our meals together in a dining room. We were waited on. We would have jugs of water on the table, and you never paid for any of that. That was actually included as part of your training. So it was a family atmosphere, and the smaller the hospital, the more family orientated it was. So Myrtle Street was only very small, so it was just like a big family, although it was strict.
If you were to say to someone thinking about coming into nursing today, what would you say were the attractions of being a nurse today?
There's a career pathway today. Students, there's a lot of academia on nursing now, so people go through an academic pathway which actually enables them to have a career pathway, probably a little bit more than what we did because of the expanding roles that you have today. nurse specialists, nurse practitioners. You have those roles never existed, so your career pathway was staff nurse when you qualified, and then sister, and then there was only a matron and a deputy matron, and that was as far as you went. So today it's different. I feel sometimes that I went into nursing because I really wanted to care for people. Sometimes you find today that maybe people don't always go in for it for that reason, for the caring, that they want to go into it for a career pathway, and some of the caring for the patients can be left behind. I still love nursing. I'm very passionate about patient care. I'm very passionate about maintaining high standards of care. I think we live in a very pressured world today, a lot more than we did when I started my training. I think today I would advise people that if they wanted to do nursing, they were doing it for the right reason.
You've been a nurse for 40 years.
Yes.
Why are you still doing it?
I just love nursing. I love the hospital. I love the people that I work with. And I'm very passionate about what I do. And at the moment, I don't know when I really want to stop.
You could have stopped before now.
Oh, I could have done, yes. A couple of years ago, I was eligible for retirement, but I didn't feel the time was right. And I still feel I've got a lot to contribute and a lot to give.